Now we have Dr. Jennifer Cobbina. She is an associate professor in the School of Criminal Justice at Michigan State University. Her research focuses on the issues of corrections, prisoner reentry, and understanding of recidivism and desistance among recently released female offenders. She will be talking today about women in the correctional system.
Good morning. Women who are involved in the correctional system, they are often overlooked in national discourse and policy discussions about ways to fix our broken criminal justice system. This is surprising given that the female prison population is nearly 8 times higher now than in 1980. Between 1980 and 2016, the number of incarcerated women increased by more than 700%, rising from a total of 26,000 in 1980 to nearly 214,000 in 2016. Currently, 1.2 million women are under some form of correctional supervision, and about 60% are mothers with dependent children. This is an intergenerational problem, as studies show that when a mother is incarcerated, it significantly increases the odds that her daughters will also be arrested, convicted, and incarcerated as adults. And women involved with the criminal justice system, they face unique gender-specific issues, including prior victimization and abuse, co-occurring substance abuse and mental health problems, dysfunctional relationships, as well as parenting issues. The literature shows that women follow distinct pathways into crime. Some women's offending trajectories are precipitated by victimization experiences, such as physical and sexual abuse, neglect, and traumatic childhood experience. Scholars have also shown that some girls and women resort to substance abuse and running away to cope with the pains and trauma of victimization that they've experienced, which are then likely to facilitate contact with the criminal justice system. While some women may have been pushed into crime by histories of victimization, others enter crime as a result of severe economic marginalization. Women involved in the criminal justice system are less likely to be employed on a full-time basis, and they are more likely to depend on public assistance for survival. And yet, for many of these women, their needs are not met in prison or even upon release. In a study that my colleagues and I worked on, which was led by Mary Marash, we examined the connection between changes in access to economic assistance for women offenders and changes in their risk of reoffending. And what we found is that women who received extreme cuts to their welfare benefits and who also lost monetary and housing benefits, that they had an increased risk of reoffending. Research also shows that financial difficulties faced by many women in the criminal justice system are complicated by their role as a primary caregivers to dependent children. Because incarcerated women are often imprisoned far away from families, it is difficult for mothers to maintain contact with their children as well as maintain close attachment bonds with them. So overall, what the literature shows is that abuse, trauma, addiction, and lack of income are common factors that drive so many women into crime, and which ultimately results in their contact with the criminal justice system. Consequently, since women's needs are rarely met, 1/4 of women released from prison fail within 6 months. 1/3 fail within 1 year, and 2/3 fail within 5 years. And so what the data indicates is that a lot of women are struggling to access resources as well as navigate social systems after conviction and incarceration. So as the number of women who have contact with the criminal justice system rises, it is imperative to make sure that their needs are met so that they can successfully integrate into the community, as well as this will also result in the public being safe. So it is imperative for correctional agencies and systems to address gender-specific issues during incarceration and throughout the reentry process. The Transition from Prison to Community Initiative, also known as TPCI, which was launched by the National Institute of Corrections, has several components that are gender responsive, and they do appeal to the unique needs of women. Evidence shows that states that have implemented TPCI have reduced crime rates. They also have reductions in prison populations and reductions in annual spending. While further evaluation of this program is needed to measure negative outcomes such as reoffending and positive change such as education and employment, increased federal funds of the TPCI program would further meet the needs of women offenders and also promote successful reentry. But it is also important for the House, Senate, and Judiciary Committee to approve the Dignity for Incarcerated Women's Act, which is a first step towards addressing the unjust conditions that so many women behind bars face. The initiative includes efforts to strengthen family ties by requiring closer placement of incarcerated parents to their children, increase access to visitation, as well as free phone and video communication. But it also entails banning shackling and the use of solitary confinement for women who are pregnant. And it also entails the use of parenting classes, trauma-informed care, and free access to feminine and hygiene products. While awaiting passage of the federal legislation, states such as Kentucky and Louisiana have passed their own Dignity Act. So we encourage other states to follow suit, given that the vast majority of women who are incarcerated, they are in state correctional facilities as compared to federal prisons. But it is also necessary to increase funding for the Second Chance Act, which authorizes federal grants that assist states, counties, and nonprofit organizations in implementing programs to help formerly incarcerated individuals successfully reintegrate into the community. The act has proven to be effective in helping women in the reentry process. So we know that successful integration results in lower rates of reoffending, which only improves public safety and provides significant cost saving, which we currently spend $70 billion each year on corrections. That's $70 billion. So the Second Chance Act is currently authorized and funded at $68 million under fiscal year 2017 appropriations. Funding for the program should be increased to the fiscal year 2010 level of $100 million in future appropriations to better meet the needs of women in the criminal justice system to increase their odds that they will actually desist from crime. And finally, it is important for Congress to support the Senate version of the Farm Bill rather than the House version. The Senate version protects and strengthens Supplemental Nutrition Assistance Program, also known as SNAP, which is the nation's most vital and effective defense against hunger, while the House's version will take food off the table for vulnerable individuals and families, including children. Among its most significant provisions, the House bill would require SNAP participants between the ages of 18 and 59 years of age who are not disabled or raising children under the age of 6 years to prove that they are working 20 hours a week or participating at least in 20 hours a week in a work program or a combination of the two. Those who are unable to comply would be stripped of their SNAP benefits. This rule is particularly harmful for formerly incarcerated women, many of whom are poor, and they face steep barriers to employment. They often have unstable work that is insecure, and also experience frequent bouts with unemployment. So SNAP is a vital resource for many leaving prison and jails and returning to communities, as it helps individuals and families meet the very basic living standards for providing food assistance. So given that the vast majority of women will be released back into the community, policymakers have a strong incentive to promote policies that promote social and economic integration, which would increase public safety through reductions in reoffending rates and decrease correctional costs for state and local government. Thank you.